Welcome to our channel. This video tutorial is about hand-foot-mouth disease. Friends, recently this disease has been making a lot of news and recently some of the schools in Chandigarh were forced to close and people adopted the home schooling or home education after the coronavirus. So we decided to make a video for general awareness of the public on hand-foot-mouth disease. Friends, I have already uploaded a video in Hindi narrative on our channel, and if you want to watch the video in Hindi, then you can go to our channel, and I will also share the link for Hindi narrative in the description. Friends, in this video we have covered in detail about the causes of this disease, how does it transmit from one person to another person, what are the prevention, how we can safeguard our children from the disease, and what are the commonly available treatment for this disease. So stay tuned till the end. Friends, hand-foot-mouth disease, this is a common childhood illness like any other viral illness, common cold illness, which commonly occurs in children less than 5 years of age, and it is a contagious disease. That means it spreads from one infected person to another healthy person. So contact with the body fluids or secretion is required for the transmission, and we will see more in detail in the subsequent part of this video. So the main mode of transmission of this disease are: if a normal healthy person touches something which has been infected or contaminated by a infected person or patient, like while sneezing or coughing or drooling of the saliva, or while we are talking to each other and the distance between two persons is less than 3 feet, then the droplets in the air can contaminate other healthy people. Or if we touch something which has been contaminated soil by the fecal matter or other fluids draining from the source of the infected person. So we have to understand that transmission is by like any other viral illness, like the mode of transmission is similar to the coronavirus, and prevention is the best treatment available for this disease. So this disease affects mainly young children less than 5 years of age, and that creates a lot of worry or scare in the mind of parents. And but teenagers or young adults or adults are also not immune to this disease, and anybody can get the infection. And most of the outbreaks or most of the infection will occur during summer or fall while the humidity level is high. Friends, the symptom of this disease, that means this disease usually will subside in 5 to 7 days without any treatment in most of the patient. So we should not be worried, and we should know about the disease and what are the commonly available treatment and prevention, and that is the best tool to fight against this disease or the outbreak. Friends, information shared in this video is based upon standard medical textbooks, and most of that information is also available on the website of CDC, and another website is, I think, the national website for the children, and the link for those websites I will share the description. And if viewers want, they can go through those websites and have more information and verify the facts also. Friends, I want to make a disclaimer here that this information is for general education to get rid of the fear of this disease, but no treatment should be started based upon the information available on YouTube or on the internet that can be hazardous. So before starting any treatment, please consult your doctor or the expert, and then only start any treatment for any disease. The sign and symptom of Hfmd, that is hand-foot-mouth disease, are like any other common cold. As I said, that is it will be fever, mild fever. Child can complain of headache or sore throat, irritation in the throat, or the child can have a runny nose. That are all symptoms that will mimic a common cold symptom that most of us are aware. After the onset of fever, the child may complain of painful sores, that is small painful ulcers in the throat and in the tonsil area. There can be rash or water-filled blisters, and reddish spots on the palms and soles or in the diaper area of the child, which are not usually itchy, but a child can complain of pain while touching the palms and soles of the feet. A child can have a poor appetite, or the patient can have poor appetite, and they will be difficult to swallow anything, and child may refuse to eat anything because of the pain and difficulty in swallowing. And once the rash healed, the skin in the rash area may peel, but it is generally harmless, and it has generally no consequences to the patient. Friends, we have to understand one thing very clearly, that all viral illness like this disease, that is hand foot mouth disease, these are viral illness, and antibiotics are not meant for virus, they are meant for bacterial infection, and so no antibiotics are generally required, and they won't help. So, for the children who are more than 6 months old, giving acetaminophen, that is paracetamol, which is generally over the counter drug available freely, or ibuprofen can be given for palliation of the headache, fever, and sore throat. So, if your child has symptoms which are troublesome, so the paracetamol or the ibuprofen is helpful. But you should remember that children less than 6 months of age, we should avoid ibuprofen. So the safest drug, in my opinion, will be paracetamol. But you should take advice from your doctor before starting any medication, as I said before. Friends, the most important thing which I want to convey to my viewers, or if I want to give you one message from this video, will be that please never ever give aspirin or products, that any medication or combination that contain aspirin which is for the children. So friends, for any fever or for any common cold, we should never ever give the aspirin which is commonly available in the home, like Disprin, Ecosprin. So it should be the Rey syndrome, and which can be fatal in children. So please remember my words. For any fever, headache, never ever give aspirin, Ecosprin, or Disprin to your children, which can be really harmful or can be fatal at times. As I said before also, most of the patient of this disease will get better at their own, and maximum in 7 to 10 days or 5 to 7 days the disease will go away. So we should not panic, and we should have proper knowledge, and most of the cases this disease will go at its own, and the patient or the child will be healthy in maximum 7 to 10 days. For the general care of child, if the child is under 1 year and he or she is being breastfed before, so you should continue to give him or her the breast milk, formula feed, or both, whatever he or she was taking before. Soft foods like apple sauce, mashed potatoes, oatmeal, or eggs, mashed eggs, these are easy to swallow, and the acceptability of child will be more. So we should be giving more of these foods like apple sauce and mashed potatoes. Because of the pain, child may not want to eat, as the swelling of the food is painful. So we have to be patient and encourage a child to eat slowly and steadily, and that will be helpful. For older children, for more than 1 year, we should give them warm fluids like chicken broth, chicken soup, or apple juice that are easy to swallow, and they are more palatable. Giving half teaspoon of a liquid antacid like Gerusil, and we tell the patient to keep the antacid in the mouth, will help to soothe the sores, and child may be able to swallow better. But always keep in mind that no antacid or any drug we give should not contain aspirin or Ecosprin or Disprin. As I said before also, that can be fatal, and I am repeating, we should never ever give any drug or medicine containing Ecosprin or Disprin to child. So just keep in mind this thing. For older children more than 4 years of age, lozenges like commonly available lozenges in India, Vicks, that can be helpful, or we can use the sprays which contain local antiseptics. But remember that local antiseptic spray should not contain benzocaine, which can be harmful to children. And rinsing the mouth with 1 teaspoon of liquid antacid, which does not contain aspirin, can also be helpful. That will, have a soothing effect on the sores, and child will feel better. So that can be given twice or thrice in a day, like Gelusil or commonly available antacid, which contain a mild amount of local anesthetic. For older children who can gargle, so we can mix half to 1/4 teaspoon of commonly available table salt to 8 ounce of water. 8 ounce will be like 30 ml is 1 ounce roughly. So roughly 200 to 250 ml of warm water mixed with the half to 1/4 commonly available table salt. We can tell the child to do gargles, and tell the child to spit it out, because drinking of the salted water can induce vomiting, and that will compromise the child health further. So tell the child to gargle and spit it out. So what are the conditions or alarming sign and symptom when you should or you must meet your doctor? Like child is complaining of lot of pain in the neck or in the chest. There is a pus coming around the sores, or they have become unduly large, and there is swelling, and there is a lot of redness. A child is not able to swallow at all. Then in this condition we may have to give him saline water. Or if there are any signs of dehydration, like the mouth of the child or the tongue of the child is sticky and totally dry, a child is crying but there are no tears coming out of his eyes or his or her eyes, the eyes are sunken and the hand looking drawn in, the child has not wet his diaper for 4 to 6 hours, or in the grown up children the urine is very dark in color, or child is not passing urine for 6 to 8 hours, then these are all alarming signs, and that indicates signs of dehydration, and these are the conditions when we must seek expert opinion and get treatment accordingly. Other conditions when we must seek expert opinion will be when the child is less than 3 months of age and his temperature is more than 100.4 degree Fahrenheit, or in older children more than 3 months of age when the temperature exceed 102 degree and which does not subside with the medicine, like I said, paracetamol, or in more than 4 years of age when the child having temperature of more than 102 degree Fahrenheit which is persisting for more than 3 days, and even after the medication the fever is not subsiding, or child has seizures, he is looking too tired to get up, and child is not able to talk, there is a difficulty in communications, or we are finding it difficult to wake up the child, or the child is not getting better. Usually the child should get better in 5 to 7 days, or maximum 7 to 10 days. So these are the all things when expert opinion or maybe hospitalization may be required. So just remember, if the temperature is not subsiding with the medication, or it is going very high degree like 102 degree, so we should seek a medical advice. So friend, as far as the prevention is concerned, presently there is no vaccine available, and scientists are working on it. Hopefully, like in the initial phase of coronavirus, there was no vaccine available, but as the scientific knowledge evolved, we had that if we may have a vaccine in the near future. The virus spread faster in the first week of illness, so we have to take more precaution, but it stay in the body for weeks after the child feels better. So child will recover in 7 to 10 days, but the virus can stay in his body for a longer period, and that can be problems to others. So we should continue to take the precaution even after the child has recovered fully from the disease. So, and prevention is the only best remedy to break the chain. So knowledge is the power, and we should take proper preventive measures that will help to curb down the outbreak. So we should teach our child not to touch the rash, and the child should avoid putting fingers or toys in the mouth. Avoid rubbing the eyes. That will, infect the hands and will be, transmitting more virus. And whenever a child is sneezing and coughing, we should teach the child to use tissue or in the shirt sleeve, and use your hands whenever he touches the contaminated area or after any sneezing or coughing. So use soap and water liberally. We should wash our hands in the running water for at least 2 minutes. And same precaution will apply to the caretaker, to the parents, to avoid the contamination and getting the infection. To break the chain, we have to follow these precautionary measures. Similarly, the bathroom articles or toys and other objects which are contaminated by the excretions should be washed with soap and water, or use alcohol-based disinfectant. And virus can live on these things for many days. So we should take proper precautions and avoid sharing the cups, eating utensils or napkins, etc. And while the child is in the contamination phase, we should avoid hugging and kissing, because that will be spreading more virus. The next important question, which is most commonly asked, is so when should the child return to school? First thing is, whenever your child has any symptom which is suggestive of hand foot mouth disease, or your child has been diagnosed with the hand foot mouth disease, then you should inform your school or daycare, or if the person is adult, then your office. And the school personnel, the office personnel should know that such and such incident has happened, and they should watch for the symptom in other children. And they can inform the parents of other children that such and such outbreak has happened, and they should keep a watch on the symptom in their children. Friends, it's very important as a responsible citizen. We should convey the information, and that will help to curb the outbreak. And normally children should stay at home at least for when the child is asymptomatic and has no fever for 24 hours, and his ulcers or sores in the hands and mouth has healed. But we should take the help from local guidelines, local authorities, and follow their guidelines, because the guidelines to return to school may vary from place to place. So consult your local authority that when our child should return to school after getting the infection. Another common, the misbelief or disbelief is that animals also get this disease. Friends, animals like cattle, pigs, sheep, and goats also has similar disease, but it is a different virus, and we don't get infection from the animals. And it is called hoof and mouth disease, and is a different than hand, foot, mouth disease. So we should not be worried about that. So quickly, the brief recap. So the hand, foot, mouth disease is common in young children less than 5 years of age, but anybody can get it. Even the adults are not immune to it. And this illness is usually not serious. Usually it will settle, or the patient will get recovered in 5 to 7 days, maximum 7 to 10 days without any treatment. But it is very contagious. That means it spreads very easily from one person to another person, and it spreads quickly in the school and daycare center where children are staying closely. As far as treatment is concerned, we are only treating the symptoms like fever, headache, or so we are using paracetamol is the most commonly prescribed medication. And we should attempt that our child should not get dehydration. Over-the-counter medication to relieve fever and pain are commonly prescribed, and never ever give aspirin to children. And drink enough liquids. Mouth sore can make it painful to swallow. Make sure they drink enough to stay hydrated. Main complication of this disease are dehydration. There can be deformity in the fingernail or toenails. Rarely, the serious complication of this thing can be viral or aseptic meningitis, encephalitis or paralysis, that it will be like infection in the brain, and that can be alarming thing. So but it is very rare, and we should not be scared. We should not be much scared, and most of these children will recover at their own. For pregnant ladies, I will say they should take more precaution, and they should try to avoid the contact with these patients. And if you think you have this disease, or if you are exposed to such a patient with the hand-foot-mouth disease, then although complications are very rare, and but you should consult your obstetrician, and keep in mind that the duration of pregnancy will decide the effect of this virus on you and on your child. So thanks for watching, viewers. I hope the content of this video will help you, and you will have some more information, as prevention is the only cure. So thanks for watching, and let's fight this disease together with knowledge. If you like the content, please do subscribe to our channel and share the content with your friends or relatives. Sharing is caring. Thank you very much.